So thanks for joining us. This is our monthly Strengthening Families Networking webinar. Today we are talking about applying CSSP's anti-racist intersectional frame to our work. And this is a topic where CSSP has been working for a long time, which is not to say that we have it all figured out, but we do have some tools and resources that we thought could be useful, as we know so many organizations and individuals right now are looking for ways to be more intentional in our work. Getting beyond just talking about equity to doing more about it and using anti-racist approaches. So I'm excited that seemed to resonate. We had a very high number of registrants for today. Lots of you are still coming in. So I'm going to get us started. A few words about Zoom webinars. You can you come in as a participant. You cannot show a video, so the only videos you see are folks who are presenting today. And you are automatically muted, but you can unmute to speak. We can unmute you from our end. And if you would like to make a comment or ask a question, you can raise your hand so that we can unmute you that way. You can also always type into either the chat box or the Q&A box. When you type into the Q&A box, we're able to respond in a little more orderly way where others can see the question and the answer, where the chat box can be a lot in a row and you can't always tell what's a response to what. So if you use the Q&A box, we will respond to it as you see in that example. We will share the answer for everyone to see if it's a content question. If you're asking for questions like struggling with your technical issues or audio, we will just respond directly to you. But let us know if you do have any challenges and feel free to raise your hand. If you have a question, we'll have a few points during the webinar where we're asking you to respond to polls or to type something into the chat box. And you're always welcome to ask questions. All right, a little bit about these webinars before we get into our topics for the day. This is an open invitation. Anyone who's using the Strengthening Families Protective Factors framework is welcome to join us. We convene them between the Center for the Study of Social Policy, where I work, and the Children's Trust Fund Alliance, who have been our longtime partners in this work. We coordinate a different topic or guest speaker each month, and we always welcome your suggestions, welcome you to volunteer to say, here's an interesting way I'm implementing Strengthening Families and I'd like to share about it. Just let me know if that's the case. And I'll also point out that the recordings and slides and handouts from webinars for many years are all posted on a Google site that the Alliance maintains. So today's webinar recording and slides will be posted there in the next couple of days. And you can always go through and peruse past topics there to see if there's topics that would be of interest to you. So we do these on the second Thursday of each month at this time. And next month, that'll be on August 13th. We're actually going to use that time for something we do about once a year, a technical assistance clinic. So it's just kind of a place for you to ask questions that you have about strengthening families, questions that have come up when you've been training people or when you've been implementing it in your own program, or a thought, a question that you have that could be more fundamental, just sort of about the framework or about one of the protective factors. So bring any questions like that, and we talk through as many of them as we can in the hour that we have. When you go to register for that, you will see an option to enter a question in your registration, or you can email me a question in advance, or you can show up that day with a question. And you can also come prepared to answer other people's questions, because the knowledge of this network is really amazing. There's always someone who has another idea or can say, oh, I encountered that problem, here's how I solved it. So please join even if you don't have a specific question, because the conversation is usually really good to hear what folks are asking about and to chime in with your own answers. You can always find the topic of our next webinar in our e-update newsletter, or on CSSP's events page, or on that Google site from the Alliance that I mentioned. So look around if you're not sure what the topic is for an upcoming one or where to register. You can usually find it one of those places, also on our social media. All right, so are people struggling to hear me? It's in the chat, sorry. A few people are saying that it's hard to hear me. I'm going to talk louder. Some people are saying they can hear just fine. So if you're having a hard time, if you are connected by phone, I would try switching to computer. If you're on the computer, switch to phone. Sometimes that's all it takes. wiggle your headphones. That's the problem I had earlier. So see what you can do. It sounds like it's not across the board. So I will try to speak louder, but also you might need to adjust that on your own end. All right, so I'm going to share a couple updates from the Center for the Study of Social Policy, along with my colleague Jang Lee. And then Teresa Rafael will share some updates from the Children's Trust Fund Alliance. And then we'll get into our big topic for the day about applying the anti-racist intersectional frame. And I am very happy that Jang is joining me to co-present on that as well. So let's jump in with some updates from CSSP. As I said, Jang and I are co-presenting today. I wanted to make sure everyone knows that Together for Families Conference will be held October 14th through 16th. That was initially supposed to be held in Seattle. It is now going to be a virtual conference. We're getting great lineup of speakers and sessions and learning a lot about virtual conferences and how to make it as engaging as possible and give you opportunities to network with the other people attending and all the things that we usually get out of conferences. So I hope that you will join us. Registration is open if you go to togetherforfamilies.org. And we are really excited that some people might be able to join us who wouldn't have been able to in person with the, not needing to cover travel costs, not needing to worry about being away from home, some of those considerations. So we hope that you will look at it and consider coming and bringing other colleagues. I'll also point out that at this conference, we're going to have a session that's also about applying the anti-racist intersectional framework to family support work. And I hope that some of you will start thinking about this today and come to that conference in October and share what you've already started to apply. So this is an ongoing conversation that we're starting today, and that conference is one of the places that will continue it. A couple other announcements from CSSP. We just, on Juneteenth, announced a collaborative movement called Upend. This is in partnership with the University of Houston Graduate College of Social Work. And the Upend movement is working to create a society in which the forcible separation of children from their parents is no longer an acceptable intervention for families in need. So really radically rethinking how our communities support families and what the role of a child welfare system is and should be. This is a rapidly developing area of work. There will be a virtual summit in September. And if you look at the hashtag Upend or look on our social media for CSSP, you will find more information. I really encourage you to engage with that if that's something you're interested in. Our policy team recently released 2 new briefs, one about building an inclusive system of supports for immigrant families during the pandemic and always, and one about supporting kinship care providers during the pandemic and beyond. You'll notice a theme. Our policy team has been really looking at the policy areas that we've always been concerned about, but that the pandemic has really brought into stark relief of where there are disparities, where there are systems that are not working the way they should, and what we can do immediately and how we should think longer term about better supporting families. And I encourage you to check that out. Those 2 briefs, as well as all of our other COVID-19 responses, are in one place on our clearinghouse of resources. So if you go to our website, it's one of the things at the top of the page, or you can use the link here to go see our COVID-19 clearinghouse. And I hope that you will check those out and weigh in on them if you've got an opinion. We'd love to hear it. All right, Jane's going to share an update from the Dolce project.
Thanks, Kaylin. Hi, everyone. My name is Jang. I take he, him, his, and I work as a program research assistant for CSSP. So Dolce is putting out a request for applications for nonprofits and local governmental agencies interested in implementing Dolce. For those that may not be as familiar, to give a super quick overview, Dolce is an evidence-based pediatric approach that addresses the social determinants of health for infants from birth to 6 months of age. And we really use a multi-sector approach that brings together a community health worker, which we call family specialists, a legal partner, and an early childhood system into what we call the Dolce interdisciplinary team. And so this team will meet weekly for case review to problem solve and connect families to resources and address the social determinants of health. So the RFA is for those that are interested in implementing Dolce within their community, and we will be awarding up to 4 planning grants of $40,000 each. that support the initial planning for Dolce implementation. And we're also interested in communities that want to innovate the Dolce approach by either applying it prenatally or beyond the 6-month well-child visit. So if you're interested in learning more, please register for the webinar on July 23rd. We'll go over Dolce in more detail, talk about how it's been implementing Dolce during the COVID pandemic, and we also explore how Dolce uses the strengthening families protective factors and go over the details for the RFA. And we will post the registration link in the chat.
Thank you, Jane. I apologize that I was having a little sound challenges myself. I've just switched to headphones and hope that that helps. I'm going to hand off now to Teresa Rafael, the Executive Director from the Children's Trust Fund Alliance, to share their updates. And Teresa, I believe you're on mute.
Best laid plan. Sorry, you guys. I was saying thank you, Kaylin, and hello to everyone. I'm so excited. We have about 600 participants, and it's really wonderful to see that, and the number continues to grow. We want to share with you a few resources that we have available now and a couple of things that are coming up. These tools to build birth and foster parent relationships, if you're seeing the screen, are hot off the press. They came out last week, and they are for systems leaders. You'll see there's a guide to local leaders to building strong policy and practice foundations to support a new way for birth and foster parent relationships to grow and take place and to help support the families. If you get a chance to look at these, you will see that the protective factor framework is woven into particularly the relationship building guide, which is the piece you see on the far right. And that's the one that will be used by foster parents and birth parents to help build a relationship that will help the families be stronger and also help when the families reunite, help them reunite and then help them stay strong and together. And these incorporate some of the partnership framework that we already are using in our other work and the protective factors framework. We have an executive summary in the middle if you just want a quick overview. You could go to the next screen if you would. All of these are available on our website, and this slide shows you the link. And just a little bit, you could go even to the next one, a little bit about what is in the relationship building guide on the next slide. Thank you. Building, supporting, keeping the relationship strong, and keeping it strong after the family leaves the system. There's a lot of discussion about a new role for resource families, and these materials were all developed with foster parents / resource families and birth parents and getting their perspective to be part of what we put out. So I hope you'll take a look at those and share them with others in your state or county as seems useful. And then the next slide, we wanted to share a little bit about what we're calling the Resiliency Project. You might have heard a little bit about this earlier, but we now have it fully underway. And this grew out of our work with trying to find ways to help support families and our members and others through this really challenging period with COVID-19. So every Monday morning, we have caring conversations for parents who are part of multiple networks that we're working with. We created something called Touchpoint Parents, and they're parents who are trained, who are working closely with us, who are using a number of resources, and who are providing peer support to other parents that we work with. You could go on to the next slide. we put more information in here, so it would be available if you wanted to go back and look at it, but wanted to just give you a quick overview. Every Friday, we have a gathering for any of our members, children's trust funds, who want to come together and talk about the impact of COVID-19 on their work and some of the really creative ways they have found to continue to provide support and assistance to families and the communities in their states. And then we've tried to document what was happening because there was such sudden change and intense change. And we put together a paper about what we were learning from parents, what are some of the creative solutions being implemented by our members and by others. And you'll see the link to that document at the bottom of this slide. And then on the next slide, I wanted to let you know that we have a webinar coming up next week. We'll be talking about public policy issues that affect families and communities. And we'll get to hear from the Casey Family Programs Public Policy Team and the Children's Trust Fund Alliance. Jim McKay, who many of you know is our Public Policy Director. Jim wears many hats, but one of them we're very happy to say is as our Public Policy Director. I'll be there, and we'll really, and when you register for that, we ask you to submit any questions you have. So we'll really be trying to make that as timely and applicable as possible to those who are on the call. So you're all invited if you're interested, but it will be focused on policies that are affecting families. And then the next slide, we've been looking through the Birth Parent National Network at a number of states that are hosting parent advisory councils. And we held a webinar earlier that will be available, if it isn't already, on our website. And there was so much interest, we're doing a follow-up to go more in depth with, in particular, the Parent Advisory Council with the Georgia Division of Family and Children's Services. They've been doing wonderful work. And that's also the home of the Georgia Children's Trust Fund. So we would love for you to join us there. It'd be a time where we'll have more time for questions and answers from some great folks who are doing the work in real time they have built and are now operationally supporting a really strong Parent Advisory Council. And the link to register is available on this slide. And then on the next slide, wanted to make sure you know that all of the online trainings for our bringing the protective factors to life in your work, they're now fully updated and fully available for CEUs for a small fee. We have to pay a fee for that, so we have to charge it. But they're also available free of charge and always will be if CEUs are not needed. Those are accessible through our website. And I'm really happy that we have been able to continue our in-person, but now virtually in-person training of trainers. It's spread over multiple days, and we'll have the same rich content with the activities being adapted for a virtual setting, but it will still be a very interactive setting. So we're pleased about that, and we're doing the first one next month. And then on the last slide, wanted to make sure to share with you all some really intense discussions we're having within the Alliance. And I'm so appreciative that CSSP is hosting this topic today. It's so timely and of interest to all of us at the Alliance. When I said we have the Friday morning meetings with our members, those really have turned in the last few weeks into discussions about what can we do? How can we examine our own work and our own role in achieving racial justice? These have been such helpful conversations. And then we started trying to capture some of it in writing for ourselves and to share more broadly. And so we'd actually hoped to have something for today, but what we have found is that it's really critical that we complete our internal conversations first, and in a timing situation, we weren't able to have everyone's input. So we will continue these discussions. We're finalizing a formalized commitment we want to make to ourselves and publicly in our own actions against systemic racism, and to think about steps that we can take and are taking and will take in the future to ensure that we're operationalizing these efforts. We clearly state them in our theory of change, but we know we still have a long way to go to fully operationalize our vision and our goals. And we're taking this opportunity to look at what do we still need to do and what can we do that would really make a difference. So we're working with our members, our board, our parent partners, our team internally at the Alliance. We are really in a learning and mode, and today will be great, and we look forward to continuing that journey with all of you and with ourselves. We invite any suggestions, recommendations that you have that will help us move in this journey. Also, I know Jim McKay is here, and Jim has been working very hard on this in the Alliance. And Jim, I just wanted to give you a moment if you'd like to add anything.
Thanks, Teresa. I think you captured it very well. We appreciate the leadership of so many of our members. The diversity of our membership strengthens us, and the partnerships we have with other leading organizations, much like what we're going to learn from CSSP and their commitment to being an anti-racist organization. We know we have a long way to go to fully realize those ideals, and we are greatly appreciative of those who are leading the way and support working with them, but recognize we have a long way to go in this journey together. Thanks.
Thank you, Jim. And we do welcome and appreciate any input, questions, recommendations from you all at any time. This is going to be a long-term commitment and something that we'll move quickly on, but we have an investment in continuing to evolve in this way. So thank you, and thank you, Kaylin, for this time.
Thank you very much, Teresa and Jim. And I think that's a perfect segue into our topic for the day about applying CSSP's anti-racist intersectional frame to our work. I'm going to hand off to Jang in a moment to introduce the framework, and then I'll be talking about the specific ways we can and might and will apply this thinking to the Strengthening Families work in particular. And I didn't properly introduce Jang earlier. He is a program and research assistant at the Center for the Study of Social Policy. We are teammates on both the Young Children and Their Families team and on the Equity, Inclusion, and Justice team for the organization. And so very happy that he's joining us today, and I'll hand off to you now, Jang.
Thanks, Kaylin. So before we really delve into the conversation, we wanted to start off with a poll to get a sense of where folks are with their understanding of anti-racism. So I really want to recognize that some of us may have been steeped into this work for many, many years, while for others, this might be a relatively new conversation. So we want to recognize both parts of this polarity. So I will kick off the poll. And the question is, on a scale of 1 to 5, how would you rate your understanding of anti-racism? With 1 being no understanding, 3 being growing understanding, and 5 being robust understanding. So I will give folks about 5 more seconds to complete the poll. Great, thank you everyone. So I see that a lot of people are actually on number 3, growing understanding, which is really great. So hopefully this presentation can be a deeper dive into sort of thinking about how we can center and embed anti-racism within our work. And then some of us also have robust understanding, which is also great. And then hopefully this presentation can further challenge the work that you've already been doing. So next slide, please. So before I really dive into the frame, I wanted to talk about CSSP's own anti-racist equity journey. Here at CSSP, we really like to say that this is an ongoing equity journey that is continuous and ever evolving. And this equity journey has really happened over the course of 40 years within CSSP. Although strengthening our equity work has always been a major element of CSSP ever since it's existed. And in 2003 is really when CSSP began a formal racial equity journey by beginning to hold dialogue and effective conversations around racial equity. And so if you want to check out more about the history of CSSP, I won't go through all of it. Feel free to check out this paper that we actually wrote detailing this history and the kind of journey that we took. Next slide, please. And so this is sort of more of the recent journey from 2018 to 2020. I will note that CSSP has declared itself as an anti-racist organization, but of course this work is continuing and ongoing. And in 2018, we began working with Khalil Muhammad, who is a professor from the Harvard Kennedy School and really an expert on history, race, and public policy. So he consulted with individual teams to strengthen their equity work. And he also met with a small group of CSSP staff to help develop a guiding frame to think through CSSP's equity work. And from those conversations is where really the anti-racist intersectional frame was born. So this frame is really used as a tool, a guiding frame that helps us do our equity work better. We like to say that is an action-oriented frame. And also a living document that is meant to be continued to be refined as staff continue to test it out with their work. And so also as part of this journey, I also want to note that CSSP's equity, inclusion, and justice team got together and read How to Be an Anti-Racist. I'm sure many of you are familiar with the book by Ibram Kendi. Highly recommend it. So the internal CSSP team read that book, and then we ended up opening up conversations to the whole CSSP staff to think through how we can use the learnings from this book. And so really we take this journey in the spirit of learning and development and redefining, and that this journey does not stop here. So we really want to invite you all to also be a part of this journey in understanding the anti-racist intersectional frame, thinking about how we can apply it to our work, and challenging ourselves in knowing that just understanding these terms or mitigating bias or understanding where systems aren't failing isn't enough if we want to achieve racial justice. Next slide, please. So terminology is super important for us, as I'm sure you've noticed. So before I get into a frame, a note on terminology here at CSSP, we avoid saying a racial equity lens, and we rather say an anti-racist intersectional frame, because we see lenses as something you can take on and off. And rather, we really want to push this idea that anti-racism, racial equity is a core part of our work that needs to be deeply embedded into every aspect of CSSP. Next slide, please. And then some other definitions that I wanted to make sure we all understood before I dived into this frame. Here at CSSP, we define anti-racism as a practice of opposition to institutional and systemic policies and practices that perpetuate racist beliefs and outcomes. I'm sure many of you may be familiar with this kind of binary of one is either racist or anti-racist, right? Like it's not enough to be not racist. And so we really apply the same idea within our policy and practice. Policies are either racist or anti-racist. And then anti-Black racism, which here we define at CSSP as any attitude, behavior, practice, or policy that explicitly or implicitly reflects the belief that Black people are inferior to another racial group. Anti-Black racism is reflected in interpersonal, institutional, and systemic levels of racism and is a function of white supremacy. So it's really important that we operationalize anti-Black racism because the anti-racist intersectional frame is really grounded in the idea that racism in the United States is grounded in and motivated by anti-Black racism. And then next slide, please. And then, of course, it wouldn't be the frame without intersectionality. It is the anti-racist intersectional frame. So intersectionality describes the ways in which race, class, gender, and other aspects of our identity intersect, overlap, and interact with one another, informing the way in which individuals simultaneously experience oppression and privilege in their daily lives, interpersonally and systematically. And so intersectionality is really an analytical tool used to help unearth the ways that intersecting forms of power create oppression. This term was originated by the Black feminist scholar Kimberly Crenshaw. And it really was born from this idea that previously we see things such as racial equity, gender equity, class, ableism, as separate and distinct categories, but intersectionality really pushes us to understand that anti-racist work cannot include an analysis of the impact of gender or the impact of class, and then the inverse is also true. A strong class analysis cannot exclude race and gender. Next slide, please. So now that we've sort of defined all these tools, all these terms of an anti-racist intersectional frame, I'll dive into the key points of the frame and then provide a concrete example of how the frame pushes our thinking. So again, I really want to emphasize that we see the frame as a conceptual tool that's used to examine the power held by institutions and systems that really oppress Black, Indigenous, and people of color. And the frame also provides a guiding approach for working with and in communities to create a more just and equitable society. So these points can seem a bit conceptually heavy, so bear with me, and then we'll provide some concrete examples for how the frame can really advance our work. So the first point of the anti-racist intersectional frame recognizes the social effects of racism and that omitting a racial analysis from any work allows racist systems, laws, and policies to continue operating within the status quo. The frame requires an understanding that the impact of racial oppression is not fully realized without interrogating the intersections of all forms of oppression. That includes SOGI, which stands for sexual orientation, gender identity and expression, class, immigration status, and ability. This really gets at the intersectionality term that I was talking about previously. The frame calls out white supremacy and white privilege, understanding the historical role of the enslavement of Black people and colonization and genocide of Native and Indigenous people. The frame recognizes that historical violence has created a modern reserve of power. The frame also uses historical understandings to examine racial and ethnic groups' relationship to power, given their proximity to whiteness and white privilege. So really emphasizing that we put things into historical context. Next slide, please. The frame also centralizes a holistic appreciation of the human experience, recognizing the importance of individuals and communities' social, cultural, political, ecological, and spiritual identities. The frame recognizes that anti-Black racist ideas depict individual Black persons' actions as a representative of the race, while whiteness is neutral and allows a diversity of experiences. And the frame questions the motivations of traditional institutions, acknowledging institutions' role in distributing and maintaining oppression based on identity. The framework asks anti-racist work to be critical of social and political institutions and systems. Next slide, please. And then last but not least, does not divorce issues affecting historically marginalized communities from the social, political, and material conditions in which they exist. The framework rejects pathological explanations and behaviors and outcomes because such explanations mask the role institutional structures play in affecting outcomes. So I'll also note here, if you want to sort of get a deeper dive into how we look at anti-racism at CSSP, definitely check out our website. It'll have a list of these resources and also the actual anti-racist intersectional frame if you're interested in thinking about how to apply that within our work. So next slide, please. So here I'll really give a concrete example to thinking about how we can use the frame. I know it can be a bit conceptually daunting. So hopefully this will help make connections for you all. And so this example is really within the context of COVID and the current pandemic that's hitting right now. And so I'll first read the dominant narrative and the anti-racist intersectional analysis and how we really applied the frame to come up with this analysis. So the dominant narrative says that Black people are disproportionately dying from COVID-19 due to the prevalence of underlying health conditions such as asthma, obesity, diabetes, etc. Black people should exercise personal responsibility and adhere to strict social distancing and make healthier food choices. And then from the intersectional frame, we have Black people are more likely to live in social conditions that make it hard to social distance. They are more likely to be part of the essential workforce, experience homelessness and or use public transportation. Food deserts create inadequate food supplies for people living in communities with high poverty. Racism causes Black people to have negative experiences with healthcare. Structural solutions that address lack of paid leave, poverty, space racism, and racism in the healthcare system must be advanced. So really, we see this shift from personal responsibility. We really want to emphasize that personal responsibility will not remove the structural barriers that deny Black people access to things such as fresh food and jobs with paid leave. So we really need to shift the blame from the individual to the structures and larger systems that all individuals live in. So we see here that the frame really pushes us to reject individualism and the pathologizing of Black behavior, and instead examine the effect of racist policies that may allow us to clearly reframe the problem as structural. And then we have another example within the context of early childhood, which I will pass over to Kaylin to talk more about.
Okay, thank you, Jane. And someone had typed in a question just before you gave the example about what was meant by pathological explanations, and I hope that became clear through the example, but if not, the person who asked that question, if you want to ask it again, we'll know that you're still wondering. So the second example is about maternal and infant mortality, and we know there are large disparities in that. So the dominant narrative that we hear a lot is Black mothers and their infants experience high rates of maternal and infant mortality in this country. This can be explained by Black women's lower educational attainment, higher poverty rates, and lower likelihood of receiving prenatal care and following guidelines for healthy pregnancy. When we apply an anti-racist intersectional analysis to that, we would have a different narrative, which is that racial disparities in maternal and infant mortality are pervasive within every socioeconomic and education level group in the United States. The chronic stress of experiencing racism in daily life contributes to poorer health outcomes among Black Americans and other people of color. In addition, medical providers are more likely to dismiss the concerns of Black patients than of white patients. And many doctors and nurses erroneously believe that Black people do not feel as much pain as white people. Structural solutions are needed to address bias among medical providers and racism in our healthcare system, as well as in Black women's lives more generally. So in both of these examples, we're shifting from a discussion about what, both about some assumptions that people might run to explain disparities that are uncomfortable, and to say that that doesn't explain the disparity. So we have to look deeper and look at the systems that are feeding into these outcomes. And if we only focus on that dominant narrative, we're not going to make headway in actually addressing what we're concerned about, which is these disparate health outcomes. And we're also not going to honor the experiences that people are having living within these systems that are leading to those outcomes. So we need to recognize what's actually going on so that we can change it. All right, I think we are going to do another poll now. So I'm going to put a poll up on the screen. Oh, okay, hold on, sorry. I have to stop sharing the first one, I think, in order to show the second one. Sorry about that. Okay, so you should see this on your screen now. You can respond about how ready you feel to apply an anti-racist intersectional frame to your work. If you're just hearing about this for the first time and not sure that it applies or how you would apply it, that would be a 1. If you're not ready, just kind of learning, dipping a toe in, that's a 2. Getting there would be a 3, where you see where you could start. 4 is ready to get started, and 5 is if you're already doing this. If this very much reflects how you've been working, then thank you for joining us. I hope you'll share some of what you're already doing and help everybody, help us all come to working in this way. We've got a lot of votes in, so I'm going to close this in just a couple seconds. The votes have slowed down, so there we go. I think you can see those results. That just a few said it's 1 or a 2. Majority are in that number 3 sweet spot again of getting there, starting to see where you could start. And a good number are either feeling really ready or already doing this work. So that's a nice spread of where people are. And what we're going to do now is get into, well, I want to stop and thank Jang for sharing the frame so thoroughly. And as he mentioned, the frame, which is a document that goes through all those points that Jang presented, is available on our website. We will post that along with the slides and the recording. But in the meantime, if you go to cssp.org, our equity work is one of the menus across the top. And so you can go to the page all about our equity work. I believe it's a portal. And you can find the frame there as well as other materials. Okay, so let's jump in to where are there opportunities to apply this frame to our Strengthening Families work? I'm assuming that you heard about this webinar and were interested in this webinar, at least partially because you are engaged with our Strengthening Families Protective Factors framework, though I don't want to assume everyone is deeply familiar with it. So I'm going to give a little look back at the history of the framework and the other materials around it. Then we're going to focus in on the logic model and core functions of implementation as places we might look at changes. Also the everyday actions and program self-assessment, a potential addition to Strengthening Families content, another resource we could draw on, and then we'll see what other ideas you all have. So I'm going to jump into it without spending too much time saying what I'm about to say. So historically, Strengthening Families did come out of thinking that was that had anti-racist goals. The idea was to lift up these universal protective factors while recognizing that they manifest differently in different families and different cultures. And we do see that repeatedly as people in other countries and different groups around the United States from different cultural backgrounds have sat with and worked with the protective factors and found maybe different ways to express them, different wording or ways to describe it, but the factors themselves ring true. However, that might not always be expressed really clearly in the materials. Another goal of Strengthening Families from the very beginning was to reach all families through non-stigmatized systems. So to not wait until someone exhibited a risk factor to start giving them support or family support services. And that's why it initially went through the early care and education system as a way to reach a large number of families that had never been in contact and never would be in contact with the child welfare system or other intervening systems, but more to say all families have strengths and all families need support. The idea of focusing on strengths rather than deficits in itself was a strategy to overcome the implicit bias of providers. And we have heard from child welfare caseworkers and supervisors, for example, who have said shifting to look at strengths as a way to deal with the challenges a family is facing really is very helpful for setting a more positive relationship and just for making better decisions with a family. about what's going to help them, as opposed to just coming in with the deficits. And we know that strategy is very stigmatizing and creates a more adversarial relationship. So the idea of focusing on strengths, which back when Strengthening Families was launched, was a very new idea in a lot of ways and in a lot of systems, really was designed to overcome some of those biases. And Strengthening Families was also somewhat of a groundbreaking initiative in terms of recognizing linguistically and culturally relevant practice as a marker of quality. So saying that if you are a quality program, that means that the families you serve see themselves represented in the books and the posters on the wall. Everyone feels welcome, all of that. Linguistically and culturally relevant practice. There's a lot of literature and research and other content about that, but Strengthening Families was one of the initiatives that early on started saying that needed to be a marker of quality. So all of that, I think, sets us up really well to do a deeper dive and say what we could do better, because those intentions have not been explicit enough in the Strengthening Families materials. And I have a few concerns. I've had a few concerns for a while that sometimes when we talk about protective factors being universal, that can sound a lot like, I don't see color, all families are the same, and that is not at all what the intent is, and I think we need to be more explicit about that. The other aspect is that one of the great strengths of Strengthening Families is that it's an approach and not a program, so everyone can take it and use it in their own programs, but also means people can ignore parts of it. And I think sometimes we have seen that people skip over the parts about being inclusive of LGBTQ families, for example, in programs, because that's too controversial in a particular state system or in a particular community. And we don't want that to be happening, right? We want to be much stronger in how we present these materials to say that this really is an approach that's designed to support all families, to meet all families where they are. And that means sometimes providing very different supports for different types of families based on what they need and what they say they need. So there's a strong base, but we have not been strong enough in how we've shared these ideals and the goals that lie behind Strengthening Families. And so I'm looking at the ways that we can, through our existing materials and perhaps some new materials, really express that more clearly. So I know we are a little bit short on time. I'm just going to show, this is our logic model that many of you are very familiar with. It's been our working logic model since 2014. It's due for an update, both to reflect more community level work and policy level work, but also to lift up more the anti-racist and intersectional aspects of implementing Strengthening Families in an authentic way. So one of the elements in that logic model is our core functions of Strengthening Families implementation. I'm not going to read off what the current core functions are, but these are the ways that we say, if you're implementing Strengthening Families, whether in a program or for a whole state, these are the things you need to be thinking about. So I think this might be one of the spots where we have an opportunity, perhaps to add a core function about advancing equity or applying an anti-racist intersectional frame. I think these core functions could use a refresh overall, so that might not be the only change, but I would love to hear if anybody wants to type in the chat box or a Q&A, share what you think about that and what you think it might be that would be a function of implementing Strengthening Families, where we could really drive home that you can't be doing this well unless you are also thinking about equity, anti-racism, and intersectionality. I'm going to keep barreling through and look at the comments once I've shared a few more things so that we can make sure we get to all of it. Another piece of content, of course, one of the main tools that people use for implementation is our self-assessment tools for different types of programs and the everyday actions that those are built around. So those have a lot of content, as I mentioned, about culturally and linguistically relevant practice and about embracing diversity among children and families at the program level. It does not really get into what any individual program might be doing to advance equity in their community, because it really is about how well are you serving the families that walk through your doors. And that's an important question, but there's other pieces to that, of course. And then I have a picture of our everyday actions here, thanks to the Alliance for this graphic. This summarizes what the everyday actions are as they're currently formulated. And you'll see that under 3 of the protective factors, we have an everyday action that is specifically about that culturally, linguistically appropriate, responsive practice, about inclusion, about honoring each family's race, language, culture, history, and approach to parenting, and helping children develop a positive cultural identity and interact in a diverse society. This may still be what's appropriate at a program level and the everyday action level, but I want to think about where we either might want to strengthen items in the self-assessment, or if there are other everyday actions or different wording that we should use with our current understanding as our thinking and this field has developed so much. So actually, I'm going to take a second to just check the chat box. I can see that lots of things are coming through. I see a few thoughts here. I'm not going to read them all aloud because we'll won't have time to discuss everything. But I do see some good thoughts and challenging questions. I see someone shared a link to an article, so I'm really glad that everyone's getting engaged in the conversation here. Okay, I'm going to keep moving through so that we can focus on the conversation in a minute here. I see a question from Jamisha. Are there any Black panelists today? There are not. One of the issues that we probably also need to be talking about is the diversity of the workforce that's in this work. And I'm very pleased that Jang was the volunteer from our Equity, Inclusion, and Justice team to join me today to present this. That is a very diverse team, and the folks that developed the anti-racist intersectional frame represent a lot of diversity and a number of Black voices in that. But yes, you're right, Jamisha, thanks for asking about that. We do try to be cognizant of the diversity of who's the face of this work, but we also try to spread the joy and work of sharing this out among our whole team. So we can't all be represented every time, but I appreciate asking about that. Oh, Jamisha responded to the word volunteer. I just mean that from our team, in the context of our jobs, when I said who's able to join me to present on this webinar, Jane was the one who raised his hand. So it's not a volunteer role, more choosing a task within the context of our jobs. So I am going to keep moving through our content. Thank you for raising these questions. And I wanted to share a couple of potential things that could help to strengthen our materials and approach. One is for those of you who are familiar with Youth Thrive. That's our parallel framework of protective and promotive factors for youth and young adults. And within the Youth Thrive materials, they start with guiding premises. We have not had something parallel to that in Strengthening Families, and I'm wondering if that would help to advance this work, because as you'll see, the guiding premises are all start with young people are best supported by practitioners who, and then it's things they understand, things they focus on. And the last two, one is about the role of race, racism, and bias, and the ways, sorry, my screen is blocking that, the ways in which race, other identities, as well as privilege and power shape the young person's life, as well as the practitioner's own life. And then also about culturally responsive services. So we could consider adopting a set of guiding premises like this. Some of you who have been using Youth Thrive, I'd love to hear if you feel that those guiding premises would be a useful addition to have something like this in Strengthening Families, which clearly would be slightly different, but could be along the same lines. And I also wanted to share Another tool that CSSP put out about a year and a half ago, the Manifesto for Race Equity and Parent Leadership in Early Childhood Systems. This was put together by a group of parents from communities that are part of our EC Link network. And they came together to work on parent engagement and leadership questions, and quickly came to saying what we really need here is to bring the questions of race equity and parent leadership into the same conversation, because so often we try to talk about one without talking about the other. In particular, we tried to talk about parent leadership without talking about race equity. And the message from these parents, from their own lived experience and their observations of the systems that they were engaged with and trying to change, was that you can't have authentic parent leadership if you aren't addressing issues of race equity, and you can't achieve race equity, particularly for young children, if you aren't effectively engaging their parents and building the leadership of those parents. So that's another tool that, because it came out recently, has been sort of in parallel with our Strengthening Families materials, and I'm looking for ways to more strongly integrate it. Okay, so while we only have a few minutes left, I want to stop and ask, where else can we strengthen our messaging and apply the anti-racist intersectional frame? What other resources should we be considering? Throw those resources into the chat box. Even if we can't discuss them all today, we will be going, following all those links and looking at all of your comments. And who else should we be engaging as we make these changes? The comments asking about who's involved in presenting this are very relevant. And I saw the follow-up question about whether any Native Americans were involved or in the panel, and the answer is no. So I think we do need to be very intentional about who we engage in helping us make these changes and learn from as we make any changes. I see a comment. I've shared the manifesto with all my parent groups in South Carolina. It shows the power of parent voice. Thank you. I'm a huge fan of that manifesto, so I hope lots of you have seen it. I see a lot of comments about that we need to reach a larger audience, definitely, and probably have more time for the conversation. As I said, we'll have a session at the Together for Families conference in October on the same topic. Would love to have some of you who have already started thinking about this either before or just started today to join that conversation and keep it moving. I see, are you able to provide any support to other organizations and sectors who want to apply the anti-racist intersectional frame? We can. We are actually looking at what we can formally do for folks in terms of other organizations that want to learn from us. We do have all those materials available on our website for anyone, but we also have some trainings we can provide. We have an institutional analysis process that is on a contractual basis that a system, typically an intervening system, can contract with CSSP to come in and do an institutional analysis of where there are disparities and what is driving those. I see lots of suggestions of groups to look at, and I love this. Can't wait to start digging in on the things people are sharing. I see a question from Corey Best about whether CSSP has measured the impact of that journey and process toward anti-racism. I wouldn't say we've measured it. I think we've been very thoughtful about looking at the impact, but I don't think I could say we have any hard measurements of that, but it's a really good question. So thank you. I see so many great questions coming in. I'm wishing we could get to more of them today, but I know that we are getting towards the end of our time. I do see a question that was typed in about resilience and whether the concept of resilience puts an undue burden on families to get past systemic challenges. That is such a good question, Maureen. And I hope that you will come to our August 13th technical assistance time where we can really talk about that, or send me an email. I'd love to, either go back and forth on email or have a conversation, because I think that is really important. And I think while that's not what CSSP has meant by resilience, it is frequently interpreted that way. And so we need to be careful about the words that we use and how we express the nuance that we really mean. So thank you all for joining us. We are at the end of our time. I'm sorry that we ran out of time to get to a lot of these questions, but really grateful that you all took this time to join us today and to think with us. If you have a chance to stay on, please type one word in the chat box, 1 or 2 words, about how you're feeling about applying an anti-racist intersectional frame to your work. Anybody who's able to stay on and look at this, I know it'll be great to see these words coming through. Oh, I love them. Thank you. Keep them coming. We'll keep this open for a couple more minutes, but I know some of you have to jump to another meeting. So thank you all for joining us. Thanks for being part of the work going forward, and we will be in touch. Thanks, everybody.